we'd like to hear from the president of AOFOG. Professor Okiani, please. John, is he online? तो उनको करना. Okiani to say a few words and welcome everybody to the session.
Welcome to
AOFOG session.
I am
Kazunori Ochiai,
the president
of Asia Oceania Federation of Obstetrics and Gynecology, AOFOG.
I am
I am delighted
to deliver
welcome remarks from Tokyo, Japan,
at the opening
of AOFOG session in 18th Biennial International Scientific Conference.
First of all, I would like
to thank Professor Lazia Corejo, President of SOGP,
Professor
Halima Yasmin,
Secretary General of
SOGP,
and all
the organizing committee members
for organizing and holding
the AOFOG session at this international conference.
You,
SOGP,
are very
supportive
to
AOFOG
and
has been our member
since
1957, since
AOFOG
was born.
I am
I
very
am
happy
very
to
happy to learn
that
that
SOGP
was also established
in
1957
and
attended to the AOFOG inaugural meeting held in Tokyo, Japan.
USOGP
sent us
Dr.
Shahidi
Shahidi
Saidi.
She was our 19th president and served from 2002 to 2005. And she made our federation
much bigger and stronger.
Today's AOFOG session is a joint program organized by
AOFOG's three standing committee,
namely
Sexual and Reproductive
Medicine Committee, chaired by Professor Krishnandu Gupta, Maternal and Fetal Medicine Committee, chaired by Professor GDP Ratnasiri, and Oncology Committee, chaired by Professor Wiredak. The theme is AOFOG and women's health in COVID times. 2 years and 3 months have already passed since the outbreak of COVID-19 in Wuhan, China. Unfortunately, there are still no signs of an end, despite the effort of epidemic prevention, vaccine development, and global inoculation, and therapeutic drug development. Therefore, we must continue
to protect the health
of women as COVID-19 spreads worldwide
again and again.
Today, we will discuss how COVID-19 affects women's health and introduce AOFOG's effort to address it. I hope you learn updated information and please feedback to your patients.
Hello.
Yes, Dr. Gupta, we can hear you now.
All right. So I will give my presentation but I think what is important is Dr. Rohana's introduction to AOFOG has already been received by you on a recorded message. So I think you can play Dr. Rohana's message first, please, along with the fertility committee of AOFOG. We are conducting a webinar on basically adolescents to menopause. We have named it a lot, adolescents to menopause. if all of you join us, the mailer has so people log in large numbers from both from technology, and it will be wonderful to have all of you. So what is our committee also doing? You see, we have Professor here, who's the president. He's been very much to conceive and have what is called as a COVID corner in our web. And in COVID corner, we have very just the care of that is we have statement on people health, etc. And we have been putting for our members to go log in along with a guidance statement for women. So we've been doing all that as well. So we, with National Society, with Proxy, we have on abortion, pregnancy. With Bangladesh, we have on teenage violence. With obstetric gynecology, we have teenage mass. With the Philippines Obstetric and Gynecology Society, we focus on adolescent vaccine. With AOFOG, specific product which is the advocacy, including SRH Pacific and the oceanic region. And working with a lot of, in addition to our own organization, we are working with women's groups, NGOs, judiciary, and the press. And on a personal note, I'm also an active Rotarian. We're doing a lot of work with Rotary, with cervical vaccination, with wash schools, giving advocacy for menstrual hygiene, etc. So the large part is, the last part of is for what we are going to do. What are our future plans? And since that thought, I make it as brief as possible. We are trying to organize SRH in as many national society conferences as possible. You all have been extremely fast for giving us to speak, for me to highlight what we've been doing pre-COVID, during COVID, and now. I think the and in the Foxy conference, which we are now at the 4th to the 8th of April, in AOFOG as well. I'm extremely grateful to AOFOG, to OCI as well, to everybody for the opportunity. And again, we are going to have an SRH workshop at the 27th AOFOG conference in Bali, in Indonesia, from the 23rd of May this year. I'm sure a large number of you will be also attending. So basically, to summarize, AOFOG has resolved to take the bull by the horns and focus on issues of with a special focus on women's rights to also on adolescent sexual health. So basically, the motto is catch them, and this gives a window of opportunity. The SRH committee has also, in the past 5 years, kind of revised these very important points, and with renewed interest, we are going ahead. And he set it up in often hidden areas across our region, and we want to have some here. So, in a nutshell, AOFOG is prepared to work with all national societies, all creditable organizations, with a renewed and continued interest and commitment to promote the interest of SRH and women's rights to ensure gender equality, in addition to providing a safer and healthier life for adolescents and women of the AOFOG region and beyond. I can only end with a famous quote of our dear past president of FIGO, whom we often quote in various kind of fora, that is Professor Mahmood Patala, that women are not dying because of diseases we cannot treat. They are dying because societies have yet to make the decision that their lives are worth saving. So AOFOG has now taken it forward to move this, and as your chair of the Secretary Health Committee of AOFOG, it is my pledge to take it forward, and thank you very much to the Executive Committee board members of AOFOG and to all members of society for this wonderful opportunity. Thank you very much. God bless you all. Stay safe.
Thank you, sir. Thank you for your kind speech and your kind words, and for bearing with us.
Thank you, Dr. Gupta. We're very grateful that you give us time. In the interest of time, and because the glitches will just have short messages. Next, I'll request Dr. Shanta Kumari, President Foxy. She's a treasurer FIGO, chairperson Indian College of OBGYN. We'll have a quick message from her, and I'll take her on phone call. Calling you, Dr. Shanta.
Can you hear me? Hello.
Yes, we can hear you, Dr. Shanta. We can hear you.
Thank you very much. Good evening, everyone. I bring greetings from Foxy, Figo, and AOFOG. It's very happy to be here, but I think sometimes we have these technical glitches. But then it's still okay because this shows that women empowerment is the most important aspect of whatever we do. So we have seen the woman who is there trying to handle the situation very much. I'm sure the Pakistan OB-GYN Society has been working very hard to make this a successful conference. And we from India and all the organizations strongly stay by you. We all were hit by the COVID the past 2 years, and we have seen that there is something which has affected each one of us across the globe. And we realize that women's empowerment is the most important aspect, and that has actually been shown when we saw the challenges in the COVID era. We have to understand where is it that these intersect: the gender equality, strong women, and sustainable future. Unless you have gender equality, unless you have strong women, we will not be able to have a sustainable future. And that is the core. When we have empowered women, COVID pandemic or any other pandemic, I think cannot stand in front of us because women are built to survive. They are the problem solvers and natural survivors in any situation. They outlast men because of the emotional strength and support. And when you have an empowered woman, the whole family is empowered, the whole society is empowered. And we have seen that in COVID, that those educated women who had access to all the means of health were able to actually tackle COVID better. We know it's a very complex word, and we know that women definitely provide the foundation of power, grace, wisdom, justice, creativity, and hope. And what is it which has happened in this COVID? We have realized that the women's issues were affected because we have seen that the sexual and reproductive rights of women have been affected. Contraception and family planning services and supplies, which were a core component of the essential health services, and access to the services we definitely know is a fundamental human right. And these were affected in COVID pandemic. So that actually made FIGO come out with a statement that contraception must be available to people when they want it and where they want it. And that is so very important, especially the FIGO statement in the COVID era, which has come on the 13th of April 2020. When you look globally, how the countries have tackled COVID, we have seen those countries which had leadership who are women tackle this pandemic better because they know the importance of giving the best of health and services to women. Friends, we being the caretakers of women, we being the global voice of women, have to ensure that women are empowered. Then only we will be able to actually give or get the best of the health. So, COVID has definitely shown us that in this COVID pandemic, we have seen something like a silent pandemic. The intimate partner violence against women has become a silent pandemic. And only when we address this will we be able to actually come out with a holistic health. Friends, we at Foxy have been striving very hard with FIGO to say no to violence against women. I've initiated this DHIRA, an initiative to say no to violence against women. This initiative is to empower all of us, empower women to be strong, to say no to war, empower men to partner with women, empower the leaders, empower the society empower the police and the lawyers to actually partner with each other. This collaborative partnership is the only way forward, which will make accessible all the services to women, and that will be able to actually help us to fight this pandemic. Thank you, friends. Let's
Thank you.
hope
Thank you.
that there will be a solution for every problem. If there is a problem, we have to just think what is the solution. Once we start thinking, there's a solution to every problem. And that is the way I think women will deal with it. And that's the way we are going to handle COVID pandemic. Thank you very much.
Thank you so much. Thank you, Dr. Shanta, for your kind words. I'll request Professor Lubna Hassan to come to the stage to chair the session. She's Vice President, SEFOG, past President of SOGP, Founder, Director, WHI, CEO of Women's Hospital. So in the interest of time, I think we'll take the final comments from the chairpersons. Can you hear us? Can you all hear us? Can you type in the chat if they can hear us? Okay, perfect. So I'll request Dr. Shahida to say a few words, please. Thank you. Dr. Shahida, they're waiting for your comments.
Will they be able to hear me?
Can you hear Dr. Shahida?
I don't think so.
Yes.
Anyway.
They can hear you. They can hear you.
I
Okay.
can hear you.
Thank you. Thank you, all of you. Professor Okai, Dr. Gupta, Dr. Shanti Kumari, and I also see Pisake. He hasn't spoken at all, Pisake. How are you? It's good to see you. Anyway, it has been wonderful listening to you all, and we would have loved to have you all here at this conference, but since that is not possible, it is the second best thing to hear you all over the on the internet, and it's been very good to hear you. And hopefully, we'll be able to meet again soon. I hope this pandemic is over soon, and we are able to meet face to face again. And it has been very good to listen to you. And we apologize for the hitches that have taken place during the session. Would you like to say something, please?
Thank you, all the speakers. It was a very informative session. And I hope the things are, in Pakistan, they are improving. And if you people can make it, maybe after 2-3 months, we can have a total one session dedicated for AFOG in Pakistan, maybe in Karachi or Lahore. So I request you, please take out some time, because the last session of AFOG was in 2018 in Karachi and in Lahore, and we had very good meetings. We have separate challenges for AFOG, which is different from Royal Colleges and American colleges, and we have to sit together and we have to find out the solutions of the challenges which we are facing. I'm very grateful to you, and things in Pakistan are getting better. I'm not sure about your countries, but I think we can arrange your visas also, and maybe after 2-3 months we can have one session in Karachi and one session in Lahore. Thank you very much.
Thank you very much.
Dr. Lubna, would you like to say something?
Thank you very much. I have had some association with AFOG, and Pakistan is one of the countries who is proud to have a president of AFOG who's actually sitting on the stage with us. But I think regional cooperation is so very, very important. And we need to get together on COVID and on other things because it affects us in the same way. It's very interesting to listen to these talks and to even read about it. I'm one of those fortunate clinicians who actually has not treated a COVID patient. because I am kept away from them due to my age and other comorbids I have. But I know of it, I read of it, I've had family members suffer from it. So I think we are all affected. And I thank everybody who has taken the time out to be with us. And I would second Professor Fareed Zafar in inviting all of you to Pakistan someday soon. Thank you very much.
Thank you for your kind words. We're lucky to have Dr. Ratnasari, who's just joined. Sir, we had some glitches. We couldn't hear the faculty. I would request you to say a few words and comment on the topic. Just a message, please. Thank you.
Yes, I have sent already my presentation pre-recorded. I don't know whether it is with you. It's a 10 minutes presentation. If you can play it this time, it would be very good. Is it with you at the moment?
Yes, sir, we have it.
So I like you to play that the screen. Thank you.
Yes, sir, we're just finding it and playing that screen. है वो हमारे पास कौन लकी So I think there's an issue with finding the presentation. I apologize for the inconvenience. Would you like to say a few words instead, like a message? Because
Yes,
we've
actually, my presentation was on COVID vaccination in pregnancy. So actually, it's a non-live vaccine, and it's having very less problems and less side effects, and it has shown effectiveness of reducing the morbidity and mortality, including ICU admissions and cesarean sections and deaths. So we in our region we have started vaccination now for pregnant mothers safely, and some of us are in the process of vaccination the booster dose. So it has virtually reduced the number of ICU admissions, and since that inception of this vaccination program, we have not seen maternal death directly due to COVID over the last 1.5 years. So that is the message that I want to tell you in my presentation. I can see it's on the screen at the moment. So these are the pregnant women who like to have severe infection if they are obese and black and Asian minority and comorbidities and 35 years and old. Next slide, please. There's the same slide.
John, next slide.
So now when you see the global tracking in 224 countries and territories, already 97 countries have shown that it's effective in uh, recommended, and 51 permitted, and 15 still permitted with qualifications, and 40 have no position found still. Next slide. So there is no non-risk associated with giving inactivated recombinant viral or bacterial vaccinations during pregnancy or while breastfeeding. And they cannot replicate and they cannot cause infection in the mother or the fetus. The AstraZeneca vaccine has adeno-live vector, but it doesn't get activated and it does not cause harm to the fetus. Although the clinical trials on the use of these vaccines are limited, and available data do not show any harm to the pregnancy. And JCVI, that is the body in UK, it has advised that women who are pregnant should be offered vaccination at the same time as non-pregnant women. Second dose of COVID vaccine to be given at the recommended interval regardless of the gestation of pregnancy. And people who are pregnant may receive the third booster shot after 3 months after the second dose. And Pfizer and Moderna, those are the mRNA vaccines, are the preferred vaccines for pregnant women. And those who have had AstraZeneca, how are advised to complete with the same vaccine. And we should discuss the risk and benefits of vaccination with the women and should be told about the limited evidence. Also, the Chinese vaccine Sinopharm is recommended for pregnant and lactating women. And this information, the critical unknowns about COVID vaccination, efficacy and transmission, duration of protection, duration of immunity, and long-term protection after using different vaccination intervals and protection after single dose and vaccination regimes needs further research. And who are planning pregnancy can take it without any pregnancy test or any worry. And contraindications are only those who have had previous allergic reactions to the or anaphylaxis to the same vaccine or any component of the vaccine. Mild illnesses with fever, systemic upsets are not valid reasons to postpone immunization. And vaccination during pregnancy has shown producing antibodies, and they have been found in the cord blood, and it has shown it may protect the babies against them. But more data are needed to determine how these antibodies, similar to those produced with other vaccines, may provide to the babies. Side effects are mostly injection site reactions, fatigue, chills, muscle pain, joint pain, and headaches. Fever is the least common, and some women who have had this vaccination, they have done a study and found these minor symptoms are the major ones during first and second vaccination. And allergic reactions, when you see the anaphylaxis, only 5 per million was seen with Pfizer vaccine and 4.9 cases with Moderna and 7.6 cases per million with the Janssen vaccines. There's a condition called thrombosis with thrombocytopenia syndrome. It is shown only in 8.9 out of every million doses with Janssen vaccine. So we need a post-vaccination pregnancy surveillance data, and the CDC has conducted a CV, VSAFE post-vaccination health checker, and it has not shown any adverse side effects up to now with the major side effects with the vaccination. So there are some countries who have shown the feasibility of acceptance, and some countries like Mexico, India, Colombia have more acceptance compared to the Australia, United States, New Zealand. So it is mostly the developed countries have shown unlikely but likely acceptance with the other countries. And when you see the estimates of number of vaccination to be given to prevent one episode among 1,000 women, ICU admissions can be prevented with 1,010 to 5,051 admissions, and ventilation can be prevented by vaccinating 1,371 to 651 women. So vaccination has shown to reduce the maternal ICU admissions, ventilation with ECMO, maternal deaths, and iatrogenic preterm births, cesarean delivery, stillbirths, healthcare access, and increased mental distress cause. Mother's infant separation has improved, and intraction of breastfeeding has improved. So COVID-19 vaccination is the best method to reduce maternal morbidity and mortality among pregnant women due to COVID-19 infection, other than the other health safety measures that we are activating at the moment. Thank you very much.
Thank you so much. Thank you very much, all of you, for being here and giving your valuable comments and talks. We're very grateful, and I apologize again for the glitches that we had. And we look forward to welcoming you here in Pakistan in better times. Thank you so much. Thank you. So I'll request Dr. Shaida to come and give the shields to the. Dr. Fareed को दिला दें, मुझे दिला दें. Disconnect कर दें.
Okay. Thank you very much, all of you, once again. And we'll now close the session. Thank you very much. And we hope soon to meet face to face. Thank you.
Thank you, Krish. Thank you, Ratnasiri.
Thank you, sir.
Sid.
Thank you, Prof. Pisek. Thank you, Ratnasiri.
Thank you.
Nice
Thank you.
to
Thank
hear your
you,
voice.
Cass,
Thank you very much.
Krish,
That your
and
voice is
Ratana
better.
Sili. Look forward to
Thank you.
seeing you in person soon.
Okay. Yes.
Thank you.
Okay.
We miss,
we can hear
we
each
miss
other
Sarika
very
Punk's
well,
talk.
huh? We can hear each other very well.
Dhanasri,
Thank
are
you.
you
Stay,
are you
stay
well?
safe, sir. Stay safe.
I can make my voice now. I think I was
Yes,
Yeah,
little
yes.
I'm glad that
worried
you are
about
better,
sleeping
Ratanathile.
fast. Now I'm
There's no problem.
recovering.